All right, we're going to get going as folks continue to join. Hi, thank you all so much for being here today. We're so excited for today's session. This is a NAWRS virtual workshop and IRP webinar. I'm Lisa Klein Vogel. I'm a research scientist at the University of Wisconsin's Institute for Research on Poverty and a member of the NAWRS Virtual Events Committee. I'll be moderating today's event, which is entitled Centering Family Experiences in Human Services, Incorporating Family Advisory Councils into Service Delivery and Research. A quick rundown of what we'll do today. We're going to start with some housekeeping reminders from Judith Sears-Poisson with IRP's Communications Department. We will then hear from Lauren Antelo, who co-chairs the NAWRS Virtual Events Committee, about NAWRS in the virtual workshop series. We will then move on to our presentations and spend the bulk of our time there today. And then we will have time at the very end for Q&A. Judith, I'll turn it over to you.
Thank you so much, Lisa, and welcome everyone. We're thrilled to be able to co-sponsor this wonderful event with NAWRS. And just a few housekeeping items. We have an hour and a half today, and after we hear from each of our presenter panels, as Lisa said, we'll spend the last 15 minutes or so at the end for a live Q&A, and you can submit questions through the Q&A box that is down at the bottom of your screen. We did get quite a few questions submitted as people registered, so we'll also be queuing some of those up. We also hope that you'll participate through the chat. We love to know who you are and where you're joining us from, so please feel free to jump in there. We also have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email, as well as some additional resources and a link to a short survey that we hope that you'll fill out. Finally, this webinar is supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. So with that, thank you again for being here, and I'll give it back to Lisa.
Thank you so much, Judith. We will now hear from Lauren Antelo. Lauren is a senior advisor in the Administration for Children and Families in the U.S. Department of Health and Human Services. She is also the terrific co-chair of the NAWRS Virtual Event Committee and a NAWRS board member. Lauren, I will turn it over to you.
Thank you so much, Lisa, for that welcome. And I am so excited to be here today. I want to just take a few moments to introduce NAWRS to you. We are a nonprofit association whose purpose is to promote the exchange of ideas on how research and statistical analysis can contribute to the development and administration of effective human services programs. Our board of directors and committee members are comprised of volunteers from across the spectrum of human services, including program, research, policy, and design. They work in local communities, county offices, evaluation firms, state agencies, and even the federal level. Every other year, we host a conference where human services folks come together to talk about their work and how it can inform research, policy, and practice. We're known for really intimate and collegial conferences, so be on the lookout for announcements about our next gathering in 2025. And speaking of being on the lookout, if you're interested in learning more about NAWRS, our other virtual events in this summer series, volunteering for the board or a committee, or you just want to connect with us, please follow the links on the slide or the QR code. On behalf of the NAWRS board, I want to extend my sincere gratitude to IRP, and particularly IRP's Lisa Klein Vogel, one of our dear members of the NAWRS Virtual Events Planning Committee, for her leadership in designing and facilitating this important session. I want to thank my co-chair of the committee, Hannah Batesh of Abt Associates, and our deepest gratitude goes to the panelists for their willingness to share the expertise they're bringing to this important topic. I'll now turn it back to you, Lisa.
Thank you so much, Lauren. All right. Well, before we hear from our panelists today, I wanted to share just a little bit of background about why we convened this panel. As many of you are likely aware, because you're here with us today, there's a growing recognition in states, in localities, and in federally about the importance of learning from families served by human services programs and on acting in their input in meaningful ways. Family input is important for helping programs to work as effectively as possible, for facilitating equity in program services, and ultimately for helping to develop policy and programs that align with family needs and goals. There are a variety of ways to engage family and perspectives, and today we're going to focus on one such way, family advisory councils. Getting an advisory council up and running and sustaining a council and acting on the council's insights is no small feat, and even knowing where to start can be daunting. And that's what brought us here today. We are here today to learn from folks who have been engaged in this work and understand more about their experiences. We have an amazing panel of folks here today. We're going to do more detailed introductions ahead of each presentation, but I just wanted to foreshadow for you the terrific range of information we'll hear about today. Our presenters will discuss leveraging parent advisory councils in human services from a broad array of perspectives. We will hear from parent experts, as well as leaders from federal, state, and local agencies. We will hear about how family advisory councils have informed policy, practice, and research. And we will hear from folks across an array of human services domains, including child support, child welfare, and TANF programs. So without further ado, I am pleased to introduce today's first speaker. A very warm welcome to Senior Policy Advisor Nicole Dobbins from the Administration for Children and Families in the U.S. Department of Health and Human Services. I'll turn it over to Nicole.
Thank you, Lisa, and the entire team. I'm so pleased to join this critical conversation today, focused on centering families' experiences in human services. Thank you to the leaders at the National Association of Welfare Research and Statistics for hosting this learning discussion. And thank you to the parents and states participating. I look forward to learning from your work. I am Nicole Dobbins, Senior Advisor within the Administration for Children and Families. My work is focused on strengthening ACF's commitment to center and sustain how we partner with people with lived experience. In the context of ACF, people with lived experience are families. They are youth, young people, parents, caregivers, and individuals who have direct personal experience with ACF programs or issue areas. However, importantly, people with lived experience may prefer different terms such as survivor, parent leader, caregiver, community member, or lived experience expert. Families with lived expertise have valuable knowledge to improve policies and design better programs that meet diverse needs. We know that their feedback leads to increased equity, innovative approaches, and better understanding. Family experiences can help us gain new perspectives. Their experiences help us interpret data and understand nuances, and also allows us to be more introspective, both on an individual and organizational level. For instance, families experience systems and services in a multitude of ways. They almost always do not experience systems in the silos that our services and programs are legislated and governed by. For this reason alone, we need families at the table and in rooms where policy decisions are being discussed. For the time I have, I want to focus on two main areas: valuable strategies and lessons learned throughout my career working in partnership with families, and second, some actions ACF is undertaking to advance our work to partner more deeply with families in a range of ways. My experience is working alongside young people who have aged out of foster care, birth families, foster and adoptive parents, and caregivers, have helped shape me and have led me to the necessary work of creating pathways for involvement in advocacy, in philanthropy, and in government. Yet my first experience comes from my own in navigating family poverty, child welfare, parental substance use, housing instability, and so on. These are not experiences I chose. Yet my role today is a chosen one, and I see it as an extreme privilege to work here under a leadership that values family input deeply. I say this because I know that intentional pathways for families and policymaking can lead to lasting and intergenerational change. And I am thrilled this conversation is getting the level of attention it deserves. Shout out to NAWRS, who had registrants at over 1,000 participants today. Again, the level of attention this conversation deserves. As we think about engaging community, I encourage us to always ensure engagements are grounded in values, relationship, reciprocity, and results. As we decide to center families more prominently in policy development or practice improvement, our approach must be grounded in relationship first and agenda second. Build time for humanness, build time for relationship, and finding things in common rather than setting ourselves apart from the families we engage. This matters because it both impacts and builds trust. What does it look like? It means including icebreakers on the agenda every time, a low-level commitment that easily can be overlooked in a rush to getting to specific tasks. For longer-term engagements like council development, strong approaches have used strength finders or other activities where both staff and family leaders are participating and learning about each other together. Relationship building helps level the playing field and address the common and very real challenge of power dynamics. You will never solve the power dynamics when the government, state or local, are the conveners, but you can do a lot to name it and address how it shows up. Next up, leadership commitment. Without leadership support, our efforts to advance practices, to establish community advisory roles, to examine policies, or co-design new programs, or our outreach strategies will fall short. This work cannot be owned by one individual. In human services, we all have a role to play in centering families and policymaking. This work needs champions across the agency, from leadership to program staff to budget and fiscal officers and legal partners. This kind of shared staff commitment builds culture change and has long-term policy impact. Mutual benefit. This is where the second R comes in reciprocity. An intentional focus on shared bidirectional learning and building social capital are critical for sustainability. Consider building into the fabric of your operations, sharing opportunities for trainings, job announcements, and connecting individuals with activities that align with their identified interests. And lastly, the third R is for results. At the outset, you don't have to be taunted by an entire system overhaul to center families and policymaking. Focus on important initiative and grow from there. For example, ACF recently partnered with SAMHSA to provide trainings about children's mental health to parents, caregivers, and community members. The trainings were highly successful with record number of attendees, and of course, they were developed in partnership with parent and youth leaders. Following that, ACF then partnered with CDC and youth.gov, and again with young people and family members to develop new external resources on the topic of children and youth's mental health, which ultimately led to an entire new webpage on ACF featuring topical resources, given this is an issue that many young people are struggling with. The goal should be to start somewhere, assess learning, and evolve. If you are waiting for that perfect recipe for engagement, trust me, it doesn't exist. However, success will happen when we are value-centered, we're humanizing, and we're partnership focused. Part of assessment is the commitment to debriefing after engagements take place. Investment in time to ask what went well and what could be improved creates conditions for sustainability. Additionally, some of the deepest insights and opportunities from my experience are in those moments where you have those opportunities to learn and grow together in those debrief opportunities. Commit to being responsive through feedback loops. For instance, you can share how you were personally impacted by what you heard, or what is being worked on as a result of the feedback gained. This can happen in a variety of ways, through informational calls, an email, an update at a future meeting, a personalized letter or certificate to parents and young people after engagements. But these periodic sort of check-in points are really critical to sharing milestones you've reached. These acknowledgements are also a source of feeling valued and heard, and are also the ways we keep parents engaged, which is another question that was surfaced many times from those who registered. These are also your recruitment tools. Given recruitment came up a lot as well, these indicators of impact that you all put on your websites, where you engage families and you share with them the impact they've had on you as a person, or on some of the outcomes over a period of time, are actually your best recruitment strategies, because the young people you're engaging, the parents or caregivers, are your best recruiters for other parents or other young people or other caregivers. This feedback loop, as we call it, is one area we're getting better here at ACF. We're documenting when families have provided input, and it's also important, as I mentioned, for sustainability. A number of reports authored through various offices include how families were engaged and also name individuals who are contributors as consultants. A really strong example of this is the U.S. Advisory Council on Human Trafficking, established in 2015, which is a formal platform for individuals with lived experience to provide advice and recommendations. To date, there were 41 recommendations to the Office of Trafficking in Persons, and an information memorandum was developed showing the status and implementation of each recommendation. Obviously, this was something grew over many, many years of commitment, but it's something they also received extreme gratitude for and recognition by those they were engaging. These are a few brief lessons learned, and I know you'll hear other valuable insights from the parents and states momentarily. Before I transition, I'll say a little bit more about the work that ACF is up to embed partnership with families and center it as a culture of practice, meaning the vision to ensure family involvement is in policymaking and is central at the outset and not auxiliary. An internal ACF advisory group has been developed to focus on sharing learnings and build internal capacity across the agency to really talk about those issues that are where contracting is getting stuck, compensation, how we are building this work into grantees. The first of its kind to really network the offices across the agency to talk about issues that we know are central in engaging families. An internal survey across the agency tells us that nearly all programs are engaging families on a regular basis. And really the survey reveals that the question is not, should we work with parents and young people in policymaking, but how do we do this work better and to the best of our ability? We are leveraging the voices of those impacted by our programs in various ways. It's done through structured conversations, listening sessions, targeted technical assistance, and training, development of resources and outreach campaigns, in some cases, grant reviews, and even as hired staff. Getting further upstream, last year, ACF published an internal ACF playbook embedding ACF priorities in NOFOs, which help offices do more to incorporate people with experience in our grant-making process. It is my hope that we shift even more so and ACF lean even more deeply into partnering with families in consultative roles dedicated to co-designing initiatives. One of the ways we can do this is through our funding announcements and encouragement through our sub-regulatory guidance to grantees and partners. Under ACF, there are 14 program offices that operate 175 programs. So this could look like funding that allows youth and families to be involved in the planning. We are examining our payment structures internally, and we're also leaning into where we can provide clarification on the use of funds externally. An example of this is the recent Family and Youth Services Bureau Information Memorandum, which provides guidance around leading in partnership with youth and young adults and clarifies the use of grant funds for such activities. Another example of this is the Children's Bureau, where they've made updates to the Child Welfare Policy Manual, clarifying the use of 4B funds, state and tribal court improvement program funds, and independent living program funds. These funds may be used consistent with program purposes and can be used to pay per diem, travel expenses, including those with lived experience within child welfare system who are engaged by the agency in courts in development of required service planning or CFSRs. These are a couple of examples where we're leaning in to provide some clarity because we know it's important and states are interested. Lastly, I'll just share that this spring, our Office of Trafficking in Persons announced a really unique funding structure that was called ATLAS, a project standing for Anti-Trafficking Leadership, Innovation, and Sustainability Project. This discretionary funding seeks to reduce barriers to accessing federal resources encountered by survivor-led organizations, and 12 initiatives led by survivors of human trafficking received $20,000 in federal innovation and sustainability funds. These are some of the existing and varied examples and commitments being undertaken at ACF, and I'm inspired by my colleagues who are helping make these opportunities happen. And not easily, might I add. Navigating risk aversion and bureaucracy is something that we're all up against, yet tireless commitment persists, and some actions are really a shared testament. When we center families, we continue to achieve new milestones and meet the unique needs of communities. I'll close by reiterating that we all have a role to play to make families front and center in policymaking, and I hope you find motivation in today's conversation. I'll turn it back to you, Lisa.
Wonderful. Thank you so much, Nicole, for those wonderful comments. We are going to transition now to our second group of panelists. We have folks today who have implemented family advisory councils in child support agencies. We're first going to hear from Connie Chesnik, Administrator for the Wisconsin Department of Children and Families, Division for Family and Economic Security. And then from Michael Adrian, Program Development Division Director for the Michigan Department of Health and Human Services, Office of Child Support. And Shaunta Patton, Advisory Council Member with Michigan's Office of Child Support's Community Advisory Council. I will first turn it over to Connie.
Hello, everyone. It's my pleasure to be here with you today. Thank you, Lisa. I am going to, as Lisa said, I'm with the Wisconsin Child Support Program, and I'm going to talk a little bit about our process for establishing our parent advisory group. I'm going to be followed by Michael Adrian from Michigan. Their advisory group has been in existence quite a bit longer than ours, and so he is going to be able to address some of the challenges that they faced along the way and some tips that might be useful to you that you can benefit from their experience in setting up your own council. Nicole did a great job of talking about the why we do this work, so I'm not going to delve into that extensively other than to say that the child support program is evolving to be one that uses a more whole family approach to service delivery, designed to meet people where they're at. And part of that is taking into consideration the views and opinions of the people who we serve, and asking ourselves who our decisions are going to impact and how. So my first piece of advice to all of you is there is a plethora of research out there on this topic. I am also chairing an effort at the national level to establish an advisory council and was overwhelmed with the amount of research that's out there. Wisconsin was very fortunate to be able to partner with Mathematica through a pilot program in partnership with APHSA in providing us advice and consultation on the development of our council. The first thing that we did, and I will tell you this is a multi-year effort, if you want to develop a truly collaborative council that makes sure that you've developed those feedback loops that Nicole was talking about, you need to take the time up front to make sure that you've thought about all of the ramifications, all of the questions that might come up. We started with the development of a charter, and I've listed here just some of the things to think about as a part of that charter. What is your goal in creating this council? I'm going to talk in a minute about both level and length of engagement. We at the state, and I'm sure many of you are with government agencies, have some limitations on compensation. Right now, we can only provide up to a certain amount per year before we are required by our procurement policies to take something out for bid. We are at that ceiling right now. We're paying what amounts to about $50 an hour. We have 2-hour meetings quarterly with our council and some additional involvement that they might have. We have 10 members on our council and 4 alternates, and we are at the limit in terms of what we are paying them. One of the things that I didn't list on here, but that is very important, and certainly for NAWRS, is developing outcome measures. How do you determine that your council is successful, that it is accomplishing what you wanted it to accomplish? And one of the things we found out from our survey is that not everyone was happy with the compensation, and so it is something that we will be reviewing. Nicole mentioned the feedback loop. I'm going to talk a little bit more about that when we talk about level of engagement. Meeting facilitation. We had a lot of discussion. We wanted to create a group that had a diverse representation, both in terms of race and ethnicity, but also geographic representation, custodial and non-custodial parents, And so we wanted to make sure that the people on the group felt comfortable and felt that whoever was facilitating those meetings represented them. And we had someone who was very involved in the development of the committee, and very much a leader who led with empathy. He was also a white male, and that did raise some red flags in terms of, is he a person just by reason of his identity that is going to, the committee members are going to be able to relate to. And so ultimately, we decided to create a group of facilitators who rotate throughout our meetings. And we have 2 facilitators at each meeting, so that hopefully there's always someone that people in the room can connect with and feel comfortable talking to. As I said, our group is currently at 10 members with 4 alternates. We'll be talking about recruitment in just a couple of minutes. Training is an important part of developing these advisory groups, not only for the members on your panel, but also for the people who are going to be getting the feedback from that panel. At the national level, we are creating a group that is going to report their recommendations to a board of directors. And we will be providing training to that board of directors to ensure that they have an understanding for how to be responsive to the feedback that they're getting. This is something that's really very different for many people. We're used to working with stakeholders who, internal or external, are used to working on the issues that we're working on, agreeing to disagree on various issues. Now we're asking people to effectively come in and volunteer their time to give us feedback on how our programs are working. Ultimately, we'd like them to be responsible for managing this council, developing their own agendas, identifying issues that they want to bring to our attention, running meetings how they want to run those meetings. We're used to running agendas where, we need to get through our agenda, and if something is running long, we might cut it off and move to the next item. That doesn't always work when you are working with a group of people who have waited a long time to have a voice, and you want to be able to give them that opportunity to provide feedback and input. You sometimes have to let those meetings flow. And so those trainings are important to making sure that the people on these groups truly do feel that they're being heard. At the national level, one of the things that we are doing to sustain the committee or the council is to create a permanent committee within the structure of the National Child Support Engagement Association that will be responsible for handling all of the logistics related to the council, funneling feedback through to the committee, making arrangements for council members to attend in person at in-person board meetings, and making sure that as board members rotate on and off of the board, that there is still a permanent committee in place that will keep that council running. So Lisa, next slide, please. I mentioned I was going to talk a little bit about level of engagement, and I wished I'd put a different slide on here, but on this chart, if you look at the far right, that's what we're talking about today, is the Lived Experience Advisory Council, but there are a lot of options in between that. And one of the things we recently talked about at a national conference is you can start small. You don't have to start out with a full-blown advisory council. One of the things that Mathematica talked to us about was 3 different approaches: consult, involve, and collaborate. You can consult with people by doing surveys, conducting focus groups. They're one-time engagements. You can involve people by creating work groups, putting them on committees on a particular issue. Those are temporary engagements. Or you can do a full-blown advisory council that involves a collaborative effort and creates that feedback loop so that everybody is always in touch with what each other is talking about and what the recommendations of the group are. Next slide, please. I've included a link to our public web page where we put out information as a part of our recruitment effort to give potential applicants an idea of what this council was all about, how they could be heard, what our expectations were, what the advisory committee might look like, how often they would meet, just to give them some background information. Next slide, please. And then also on this link is a link to our application. This is just the first page of it. It was a multi-page application. We did discover as a result of our recent survey that we could have done an even better job of creating a more diverse panel, and we will focus on that for the future. You will see at the bottom of this application on the first page, we did ask people to answer the question why they wanted to be on our advisory group. And we asked that question in part because we wanted to make sure that we weren't just reaching people who were interested in talking about their own case, maybe had a grudge against the child support program, thought that participating on this panel might give them foot in the door to get a problem or an issue resolved. We wanted people who would use their lived experience to help improve the program overall, which in turn would help them as well. And so the answers to those questions were very informative to us in identifying panel members. Next slide, please. Following each of our meetings, and we've only had 2 thus far, we have focused both of those meetings on trust building. We want this group to feel comfortable with each other before we start delving into substantive issues. But what we use the rose, thorn, bud methodology following those meetings to identify what went well, what maybe didn't go so well, and where is there some potential in the future. We have faced challenges. We have had some issues in the first couple of meetings, and we've learned from those. Our debrief includes all of our state employees who are involved in this committee, as well as all of the facilitators. We ask all of our facilitators to attend all of the meetings so that they can see how they're going, feel connected to the committee, see where the issues are, and hopefully that helps them as they take their turn at facilitating these meetings. We also see issues come up from members of the council that identify areas that maybe we hadn't thought about, that provide us some potential for improving the committee moving forward. As I said, we just had 2 meetings. Michael is up next, and he is going to be able to address in much more depth what they've learned from their long-term engagement with their advisory council. So thank you all.
Thank you so much, Connie. Appreciate that. And we will transition over to Michael and Shaunta now. Thank you.
Hello. Thanks, Connie, for all of that. I'm here to discuss, kind of what happens after those initial implementation plans. So I'm going to try to keep it moving quickly. Next slide. So what I think is really important at this, once you really get started, is reflecting about rolling or recruitment, how you're going to do that. That is a pretty heavy lift. It was really important to Michigan that we cast the net wide. I think there is a way that you could take some shortcuts to get a council going. Would not recommend that. Casting the net wide is a good way to just make sure that you are not leaving off any communities, any marginalized communities. You could handpick some folks. You could handpick some organizations to find some folks, maybe organizations you feel comfortable with. But we did not take that route. And we did press release. We put the application out pretty readily available. And what that meant was having a large capacity to take in phone calls, take in questions, take in applications. We had a lot of applications to get through. So what we learned was that initial startup was such an effort that we needed to figure out how to do it more sustainably. So from this point forward, I would also say we have been doing this work now for about 7 years. The council has been meeting about 3.5. This is how long it takes to get started. The council, and what we learned pretty quickly is that an attempt to recruit the minute a seat or 2 seats become available is disruptive to the council, and really, again, is not a sustainable method when folks have a lot of other duties in supporting the council. So we've decided to shift to a rolling recruitment, meaning that the application is always available. And we haven't done this yet. We're still in the learning phase, even though we've been at it for a while. I encourage bravery. And if you make a misstep, you'll be able to correct it. So we want to create a web page with a video of some council members and how they value their participation. us talking about how it's valuable to us, and again, the application. Then once a year, we will make a concerted effort to go through those applications, have a panel to go through the applications, and then fill up the missing seats. Next slide. Another really important part that I think has been alluded to is there is a fair amount of fear sometimes with professionals to go and create a council. Sometimes you will not hear favorable things about what your program does, despite its very best efforts. And so, again, need to be brave to get through that. And we really like tapping professionals in the child support community in Michigan who really value and are passionate about this kind of work. We've tapped new skills and abilities of folks, facilitators, note takers, who really do feel committed to this work. And so that's really valuable and a great way to get engagement from the professionals. Also, as the council has got, as we've learned about how the council operates and how we can operate with them, the trust has been built. We'll hear from Shaunta to see how he thinks about that. But I can say that we've gotten more and more comfortable to be uncomfortable. And that's just the way it works. And also that we're learning when we are talking about important policy or program or initiatives that it immediately comes to everybody's mind in the room. We need to talk to the council. We need to find out what the council thinks about this, and really involving rather than always thinking about legislators, always thinking about what the bosses think about it. The council comes up very frequently in our discussions because we have built that kind of trust and value in what they bring to us. We do exit interviews also. This is an important element that I think someone has already spoken to a little bit to see, and we do a third-party interviewer so that we can really get an honest reflection from council members. Why are you exiting? What do you think has worked? What do you think we need to improve on? That's really important. I saw a couple of things about compensation, and Michigan pays $40 an hour. And we do have a policy within the Department of Health and Human Services not to count that eligibility, that payment against their eligibility for other kinds of assistance. So just to kind of address that. Also, how many hours does it take to have, once you do get over that startup time commitment, which is again very, very notable, as Connie mentioned. Now we're definitely not a well-oiled machine, but we're getting kind of the hang of it. And I did a very quick unscientific survey of my colleagues here in the program. I anticipate that we have about 67 hours a month to support a 2-hour monthly meeting of our council. And this is a collective number of hours from a number of people who serve a variety of activities. So just to kind of throw that out there, it's pretty unscientific, but that's what I have to offer. Next slide. What's unique about child support? I think this is, I thought this was maybe an important reflection about how to think about your council makeup. And we really reflected, as Connie said, took a lot of time to reflect about how to start this. A child support program is unique in that, right, we have an interesting dynamic and tension between case participants. We have custodial and caregivers. We have non-custodial caregivers. We have payers versus payees. We have females versus males. We have mothers versus fathers. So really kind of an interesting way to reflect about what should this council be, and how should we make it up. So we did decide to do a single council, and we have 5 male, currently we have 5 males and 5 females. We do have a few empty seats, but they're really did I think a really good job of having a diverse group of folks. And as Connie mentioned, facilitators, we have male and female, Black folks and white folks serving in those roles, as well as note takers. Next slide. Another interesting thing about the child support program is that you have some case participants who were wanting your service and other case participants who were pretty much forced into your program. Again, thinking and reflecting about how a council can help you be better at balancing those kind of conflicting needs and wants from case participants made it really even more important to have a council who can help us get through that. Next slide. I'm going to skip this one in the interest of time. Next one. Okay, I think sharing results. I'd really like to linger on this for a minute or two. The council has helped us with many things already. I do support the idea that lots of times we do hand them something that we're thinking about to ask them for their input, but it's very critical that you allow them the authority and the independence to come to us with something so that it is a shared commitment of what we all should be working on to make the program better. The very first one is the one I would linger on most, and that's the navigation services. In the very first year, the council worked very long on a proposal to be submitted to our office regarding really how awful we are to get through, to understand how we operate, to understand why I'm here, how did I get here, what are you asking me to do, and what are my options, what are my rights, what are my responsibilities. We have child support caseworkers who are very committed to doing good work, but the time is very limited. So the council suggested that we create a navigator or advocate program. Ours is more of a navigator program. I can say with confidence, the Office of Child Support would never have done a navigator program without the council highly recommending that we do that. And so I think we're collectively really proud of that work. We are doing a pilot. It is in 4 counties. It just started a few weeks back, and we now have an official role of navigator who will help case participants figure out where they're at and why they're and that sort of thing. Slide. No, I don't know. Okay, thank you. There's a couple of lists there showing what all they've really helped with, and I don't really have time to linger on much of them, but again, there's been a notable progress and really important value added from the council. Okay, next slide. I think that's it. I'm going to pass it to Shaunta. Shaunta has taken the time here today to join us, and in the spirit of nothing about us without us, I'd like Shaunta to offer up a few reflections about his participation in the council. Shaunta, welcome in.
Thank you, Michael, for the invite, and Lisa as well. I will definitely be short here, and I just want to thank everybody for coming and trying to make your system better on behalf of us. So that is awesome to hear. I'm a non-custodial parent of 9 children from a prior marriage. And when I first started and received, as you say, the calling for this this council, my idea was to fight for single dads. I felt like I was going through the FOC system, OCS system. I didn't receive equal rights with the mothers, but as I progressed through this process, I learned a lot. That I love that they have evolved with us, provided information, listened to us, and we have an impact. So how do you retain and recruit council members, right? And this is just coming from us, or from me, I rather say, for the time I've been here since 2021, I want to say. And we have members come and go. One thing that I found that's very, very important if you want to retain good council members is you have to show that their voice count, but not only count, but has impact. You know, everybody who really wants to be part of the council, they want to have an impact on the state of Michigan or whatever state you're from. So making sure that those voices is shown that they have impact. Also choose members that are committed to the process and available. You'll find people that may be committed to their own case and how they can get that done. And you do want some of that, but ultimately their desire and passion should be to make the program better for other people. Also balancing the flow of the members' voices, right? Some people like me, I may talk more, and then other people don't get a chance. Like you said, we have 2 hours. So making sure that everybody's voice is heard and encouraging to speak up. Participation will retain them longer. And also encouraging bonding and inside the council and outside. I know in our group, we really had this, what was that called? It was some chat group that we had in the beginning that we chatted outside the group, and we got a lot of our frustrations out. And then we kind of talked about some of the stuff that we talked about in the meeting, and we came in. And wonderfully, the Michigan OCS also started a Google group where we can chat now for that. And they really have adapted to the flow of this council group. So thank you for your time, and I'm going to hand it back over to Michael.
Thank you so much, Shaunta, and we'll move it on to the next speakers.
Thank you so much, Shaunta, Michael, and Connie. Our next set of panelists are here to tell us about their experiences implementing a family advisory council in a child welfare setting in Douglas County, Oregon. I'm so pleased to introduce Jessica Hunter, Program Manager for Douglas County Child Welfare in Oregon's Department of Human Services, and Diane Deleon, a Parent Advisory Council member for Douglas County, Oregon. Turn it over to you, Jessica and Diane.
Thank you so much, Lisa. And hello to all of our friends from around the nation. It is so exciting to be here today to share this information with you on our local Parent Advisory Council for the Oregon Department of Human Services Child Welfare Program in beautiful Southern Oregon, Douglas County to be specific. So before I get started on sharing some information with you and some tips on what we've found to work well and some feedback on what we've found to be things to avoid, I want to turn it over to my partner, Diane, to introduce herself, and then we'll get started.
Thank you, Jessica. My name is Diane Deleon, and I sit on the local Parent Advisory Council here in Douglas County. As a parent with lived experience, I also sit on the State Parent Advisory Council as well with executive leadership, and I'm just so grateful to be here.
Thank you, Diane. And next slide, please, Lisa. So what we wanted to bring to the table today is a lot of messaging from the heart. This is a real heart project for us here at Child Welfare in Oregon, and I just want to emphasize that. And I want to talk a little bit very quickly about my experience working with a Parent Advisory Council. Just a little background. I've been a child welfare practitioner in Oregon for a little over 24 years. And I've worked in a variety of roles as a child protective service worker, permanency worker, hotline screener, supervisor, staff trainer, and now I am a program manager, one of 2 program managers for our child welfare office in Douglas County, Oregon. I had the opportunity a few years ago, thanks to our executive leadership in Oregon, to experience in a meeting setting some interaction with parents on our statewide Parent Advisory Council that's been up and running for some time now in Oregon. And that was a transformational experience for me as a child welfare practitioner. And what happened was during a virtual meeting of program managers, my peers from around the state, the Parent Advisory Council jumped onto that meeting and provided some feedback for us around the topic we were exploring as a team, which at the time was our agency grappling with when it was critically important, necessary, good practice to involve law enforcement in our contact with families, initial contact with families who've been brought to the attention of child welfare, and when maybe it wasn't great practice to engage law enforcement in our contacts with families, initial contacts with families in the course of a child protective service assessment. I came into that conversation with some beliefs and values that were based on my experience and training as a child welfare practitioner to date, and came out of that meeting an hour later with a completely different perspective on what families need from us at child welfare, at the Department of Human Services, at the time we make initial contact. There was a ton of powerful feedback that was a part of this conversation that I found incredibly transformative. So again, understanding that I spent 1 hour in conversation with folks who had experienced child welfare and learned a great deal and came out from my perspective a better practitioner and a better leader for our organization. And that inspired me to want to explore the viability of having a local parent advisory council for our county in Oregon that was comprised of folks who had experienced child welfare and had experienced it with our teams, frankly, and in our county. So I started off making a lot of mistakes and had to kind of regroup and reframe. And Diane and I, who were already in relationship, we already knew each other. You know, I reached out to Diane and we decided together, hey, we must have this. We must have this resource to guide our work, our local practice and policy, to guide our community relationships, and to better support better outcomes for families. So I'll just talk for a few minutes here on what we've learned so far, and then I'll turn it over to Diane. So what we've learned is that community readiness is critically important for any parents that you recruit and train and engage in this process. The community must be ready to support parent advisory councils. They must be ready to come to the table with parents and recognize parents as having the expertise that better informs policy and practice and outcomes for families. Families are the experts. So building community readiness is very important. I guess I'll give an example of that and talk specifically about our staff here at Child Welfare. One of the, I feel from my perspective, one of the best uses of our parent advisory council so far has been to train our casework staff and our family connection or visitation staff. And what that looked like were panel presentations for all of our staff from our parents who shared their experiences with CPS, the things that really went well for them and the things that did not go well for them. And this is probably the most beneficial training I've been a part of as a child welfare practitioner, and the feedback from our staff is much the same, that there's nothing that comes close to this in terms of equipping them to go out and do their jobs in the best possible ways and achieve the best possible outcomes for families, which for us in Oregon is family preservation and prevention of child and family separation through foster or resource care. So for us, the readiness part was to make sure our staff entered into this training, this experience with this parent advisory council, and that they were ready to do that in a way that did not bring about more trauma for the parents at the table who were living in such high vulnerability and in their sharing of their experiences with us and reliving trauma that frankly we had induced. So bringing those two worlds together is not only incredibly powerful, it's an ongoing kind of training thing we do, but it was super important to make sure our staff were ready to come in offer their full attention, just be super respectful, to not be defensive, and to listen, actively listen to what parents had to say. So that is an example of the community readiness I speak of. It's super important that parent advisory councils are safeguarded against any additional trauma as a result of their willingness to come in and be vulnerable and share their experiences and help create better systems. So keeping trauma in mind goes along with that. And what I did want to add to this slide is from my perspective, again, as a program manager with a child welfare agency, understanding your role is critically important as well. So we are very clear in Oregon and in Douglas County with our Parent Advisory Council, our role is that of consumer. Child welfare is the consumer of a service being offered by parents with experience and expertise with child welfare. We are there to listen and learn. We are not there to facilitate the meeting. We are not there to be involved in recruitment or retention efforts. And we do not decide on agendas or area of focus necessarily. There's some mutual decision-making that happens for sure. But as things come up and conversations roll out and plans are developed that are born of these great conversations we're having when we're all at the table together, we always must understand that overarching value, which is we are the consumer and our Parent Advisory Council is the expertise at the table, and they're providing a service. Their roles are certainly supported by the involvement of 2 other local community partners we have in Douglas County. And one of those community partners is in the role of facilitator at our meetings, and they help with recruitment and development. They've helped the Parent Advisory Council draft bylaws and guidelines for participation so that there's a step or two, there's a little bit of separation between child welfare and that particular body of work that our Parent Advisory Council engages in. And that feels very appropriate to us. So having some community partner support, not just for financial compensation for time and expertise, which is a part of our Parent Advisory Council. Our parents are compensated for their time on an hourly rate, but also to handle some of these other roles that feel necessary for child welfare to not be involved in. The other things our partners are doing just very quickly that are helpful are helping our Parent Advisory Council and our ODHS office, our Child Welfare Office, develop a playbook. So we have information in writing available to other organizations, government agencies, nonprofits, anybody that would like to consider onboarding their own Parent Advisory Council to better inform their practice. Getting the right people involved is definitely a must. Every month, our local leadership in our Child Welfare Office is at our meetings with our Parent Advisory Council. Those meetings are prioritized, and all of us attend on a regular basis. We listen to feedback. I think we come to that table with humility and with the ability to take feedback that, as has already been said, sometimes can be a little hard to hear. There's been painful conversations at that table for sure. And on the other side of those painful conversations, we have bonded and we have grown stronger and I think more resilient together, which is incredible. You must be willing and able to lean into vulnerability and discomfort at those tables. You must be able to internalize the feedback you're hearing. So just really quickly here before I turn it over to Diane, from our perspective and experience, it's really important not to confuse your role. I've done that multiple times, especially early on, and certainly Diane can attest to that, thinking that I could be a part of recruitment. I could be a part of talking with parents and partners about our dream of having a Parent Advisory Council. And what I learned pretty quickly, and with a lot of really gentle, amazing feedback from some nonprofit organizations, and certainly the primary nonprofit or organization in Oregon who helped get Parent Advisory Councils up and running in Oregon, was no, please, that's not your role. You're the consumer. we do these pieces over here, and that was super helpful. We don't stop dreaming up ways to share power. We're not just sharing power at that table and meeting together. We are out in the community together, shoulder to shoulder, engaging in different activities, community events. We're having new experiences together. We are building memories together. We are building community together. We are building partnership. All of those things are clear the way for sharing power and help reinforce in those relationships that we are all equal. I guess the last thing I'll add, I want to be mindful of time here on my piece, is that grace and forgiveness are incredibly important. We are all humans at this table. We all come with our stuff and some traumatic experiences, and there is room and intentional time built in for the grace and forgiveness part. I have watched our parents reconnect with staff with whom they were directly involved at the time they were involved with child welfare in that training setting. And there have been some incredibly powerful experiences and conversations and healing that has come out of that sort of engagement and interaction with each other. I feel incredibly fortunate to have been in proximity to watching some of that happen. And I think one of the measures of success is when you have parents sharing with you that this is actually a therapeutic process. It's a healing process for them as they take back some power and work through some of that unresolved trauma of involvement with us. That was an unexpected, amazing, completely incredible outcome of our work with a parent advisory council. Lastly, I just want to advise against inviting feedback from a parent advisory council and then not do anything with it. That it's incredibly important that when you ask parents with expertise on your organization for feedback on how you can improve or areas of suggested focus, that something's done with that. And we have a process in place where we have agenda items for the meetings. Those agenda items are decided upon largely by our parent advisory council members. They set the agenda and they lay out what they'd like for us to address, look at, think about, or change. And we take that information and we do something with it. It is dispositioned somehow. Excitingly, most frequently, we make a change with that. And we engage work groups and we figure out how we can work together to make something different or better. So some of those topics that we've addressed lately are our work with incarcerated parents, our visitation program, and expanding that into the community more and more and away from the child welfare office, which is traumatizing for families, and where we locations for where we hold family decision meetings and making sure that they're in a location that is not more trauma inducing, since most of our meetings still happen at our child welfare office. So those are just a few of the many, many things that parents have brought to our attention as areas of need and focus. And we've worked on those things and made changes. And equally important, we make a commitment to come back to the table if we're not able to change something for some reason, or if it looks like it's going to be a pretty involved change that will necessitate a policy change or a law change, frankly. And we feel like our responsibility with those things is to pass that information on to our executive leadership and others, and give updates to our parent advisory council on where we're at. And if something's going to be stalled out, we own that and talk about, that this is a long-term goal. We're going to try really, really hard to get there, and here are the things we're doing. Or we are not going to be able to do this, and here's why. So those conversations are amazing and very respectful and transparent. And I just want to say again that I've had thousands of child safety and permanency specific training in the course of my career, thousands of hours. Nothing has been as impactful for me as a practitioner and as a member of my community than to hear and learn from this Parent Advisory Council that we have. I am a better leader and I am a better worker as the result of what I've learned from parents. So with that, it's with great respect and love that I turn it over to Miss Diane Deleon for some more information and her perspective on our Parent Advisory Council. Thank you so much for your time.
Thank you, Jessica. I only have a couple minutes, so I'll just try to be fast here. So I really think that over the past year and a half that we've been doing this council, it's been incredibly rewarding experience for me on many different levels. The council's provided a platform for us to actively participate in decision making and directly impacts the community we serve, which I am a community member. I have no affiliation with child welfare. I'm not employed by them. It truly is a game changer for our community. It fosters a strong sense of community and collaboration between child welfare and parents, because there's always such this divide, it's us versus them. So having a seat at the table and with parents with lived experience at the table is just a complete game changer. So sharing the power in this is most definitely important, that everybody has an equal voice, and it's not the us versus them mentality. PAC work is a priority. Like Jessica said, it's our favorite meeting of the month. And it's the amount of time that we have which is an hour and a half for our monthly meeting together it's not enough time. It never is. Having the right people at the table is most definitely crucial. And the goal for the Parent Advisory Council is that it is completely parent run. Besides our facilitator who has no affiliation to child welfare as well, it is strictly parents. Parents run the whole council. And that's the most important part, is that there is no, child welfare employees in the council running it, because that would take away from the purpose. Let's see here. We have excellent community partners, and we do. They've been amazing. They want to know more. They've reached out to Jessica and our facilitators to be like, hey, we need parent voice on this. Can your parents come to this? We're always invited to something, and it just feels like we never have enough time. And that we are most definitely ready and motivated to make change. I think that for us parents, because we are so excited at the little bit of change that we have been able to make, that we get ahead of ourselves and we're like, okay, well, can we do this? Can we do this? I mean, we have a list, and this is like a whole page. I don't think you guys can see it. Ooh, whole page of tasks that we have either started or are in progress to do, and it just never feels like it's enough time. So I did put my email in the chat. If anybody has any questions, I'd be happy to answer. I wish I had more time, but I believe my time is up. I am so grateful to be here. Thanks for having me.
Thank you so much, Diane. Thank you so much, Jessica. And I'll highlight this beautiful picture that you all have shared with us of your council. Thank you. Okay, now I want to turn it over to our very last set of presenters today. We have a terrific team from Colorado. We have Chelsea Hall, who's the Colorado Department of Human Services Director of Family and Community Engagement and State 2Gen Coordinator. Samantha Fields, an alumni of the Colorado Department of Human Services Family Voice Council. Robert Thompson, who is a research and evaluation analyst with the Division of Economic and Workforce Support with the Colorado Department of Human Services. And with that, I will turn it over to you all.
Thank you so much, Lisa. And we are very excited to be joining the rest of our states in this presentation today, kind of the caboose. So I hope you all stay till the end. We have some exciting information to share. But yes, we are going to share some nuts and bolts about our Family Voice Council. Been in existence almost 6 years now. a real life programmatic example, which is why Robert is here, and listening to our true expert in the room with us today, Samantha Fields, who is a Family Voice Council alumni member who is here to share her lived experience, her story, and how her vast experience on many councils in our state has influenced her and the work that we all do today. So I'm going to kick it over to Samantha.
Thanks, Chelsea. Hi, everyone. I'm Samantha Fields. I'm a single disabled senior living in Colorado Springs, Colorado. I'm both honored and a bit nervous to be here today, sharing my personal experiences as a member of several lived experience councils, including those focused on Medicaid, food security, and of course, Family Voice. My personal journey hasn't been easy. Living with a life-altering disability and surviving domestic abuse that isolated me, took away my identity, and stripped me of my voice have been immense challenges. For someone like me, who has often struggled with confidence in sharing my opinion, especially when it differs from others, being part of these councils has been life-changing. Today, I want to share what that journey has meant to me, the impact it's had, and why I believe building similar initiatives can be incredibly beneficial for both organizations and the families they serve. Being part of these councils has been nothing short of transformative for me. For someone who once felt too afraid to speak up, knowing my voice is not only heard but valued has been empowering. I've faced challenges like food insecurity and navigating a complex healthcare system. And being able to share those experiences in a way that contributes to real change has helped me find a strength I didn't know I had. These councils provide a platform where our voices aren't just listened to. They're crucial to shaping better policies and services. Seeing my feedback turn into concrete changes that benefit the community has been incredibly validating. I've also made lasting friendships. There are 4 of us who have been doing advocacy work with the state of Colorado's Medicaid program, and we've been meeting every Wednesday for over 4 years to check in and support each other. Another key aspect is compensation. For me, being compensated for my time and expertise is more than just a financial boost. It's an acknowledgement that my lived experiences are valuable. It shows that what we contribute is critical to shaping programs and policies that work in the real world. Over time, this compensation played a key role in helping me work towards my goal of becoming debt-free, which I achieved on July 20th, 2023. This financial stability allows me to continue contributing while feeling respected and valued. One of the most meaningful aspects of these councils is the shared role we play in decision-making. It's not just about giving feedback. It's about being part of the conversation from start to finish. We work alongside policymakers, service providers, and other stakeholders to ensure that the decision made truly reflect the needs of those that they serve. This collaborative approach has helped me build confidence in my ability to contribute meaningfully and has fostered a sense of ownership and partnership that is essential for creating lasting change. I'd like to share a specific example how this collaborative process works. I had the opportunity to provide feedback on the Colorado Works TANF Leavers survey, which is taken by people exiting the program. This project reignited a passion from my previous career as a consultant at a health insurance company. Back then, part of my job was acquiring survey software, creating surveys, distributing them, analyzing the data, and putting that info into metrics so that data could be turned into action. That's when I fell in love with surveys. When I reviewed the Colorado Works TANF Leavers survey, I meticulously went through all 7 pages, making copious notes, and even adding a blank sheet at the end filled from top to bottom with thoughts on how to improve the survey. I actually wondered if the Works TANF team knew what they were getting into when they said the word survey in a meeting I was attending. I sent my comments to Robert's team, and as they say, if you love something, set it free. If it comes back, it's yours. If not, it was never meant to be. I didn't think about that survey again until Robert's team returned months later to update the Family Voice Council. In the Family Voice Council program, presenters are asked to let the council know if the feedback they received was helpful and how it was helpful. This practice is baked into the Family Voice Council program, and I trust in that system. Because of this, I could let go of the survey, knowing the feedback loop was in place. When Robert's team came back and shared their update, I could see that some of my suggestions were incorporated into the revised survey. I was personally pleased and thought it was kind of cool, but what mattered most was hearing that the survey was getting more responses. More responses, more data, more better. I firmly believe that every organization working with families should consider building their own Family Voice Council, Member Advisory Council, or similar engagement initiatives. The benefits are twofold. For the organization, it provides invaluable insights that can lead to more effective programs and services. When you involve the people you're serving in the decision-making process, you're more likely to develop solutions that actually work. It also builds trust between the organization and the community, which is essential for long-term success. For the families, these councils offer a platform to have their voices heard, to contribute to the shaping of services that directly affect their lives, and to be part of a community that supports and uplifts each other. It's empowering and can lead to greater self-advocacy and confidence. In closing, being a part of these lived experience councils has been a deeply meaningful experience for me. It's helped me find my voice and the courage to use it for the benefit of others. I believe these councils have the power to create real change, and I encourage any organization working with families to consider building similar initiatives. It's not just about hearing voices. It's about making those voices count in a way that leads to better outcomes for everyone involved. You could be helping someone gain confidence, stop being afraid, and feel like they are part of something bigger than themselves. The compensation you pay them not only shows that you value them, but it might mean they can buy groceries or school supplies for their kiddo, or in my case, free themselves from a lifetime of debt. These councils have a much bigger impact than you could imagine. If you don't have a council, consider starting one and do your best to make sure compensation is in the budget. If you have a council but aren't compensating or aren't compensating adequately, try to make that happen. And if you have a council and are compensating adequately, take the time to see the difference you're making in people's lives. You owe it to them and to you. Thank you, and I appreciate your time and attention. Now on to Robert.
Well, I'm going to steal the mic back. Actually, mic drop, Samantha. You're amazing. We could finish our presentation right then, right now. But it's because of members like you who have made our council what it is today. And I just want to publicly thank you so much for being here. And like the other states, nuts and bolts of our council is here. I don't want to go through it. I feel like being a little ad lib or ad hoc right now, seeing some questions in the chat. We do want to make sure that we center the voices of families in Colorado, which is why if I'm ever presenting on the council, they speak first. And I think that's really important. Also, some things like if you hear anything else from lessons learned from Colorado, I think one, and other states touched on this, is 100% family membership. They don't share seats with state or county folks. They do have a facilitator, but that's a big deal, 100% family membership. And the second thing is that we try to make our council as broad across program as we can. So it is at the state level, it's across all of our human services programs, and we invite other state agencies to join and give presentations and hear from families as well. So there's a lot on this slide. I won't go into the specifics. We do have an alumni group. People do serve a 2-year term and they usually stay with us for 2 years. And then they have alumni. And we just about a year ago launched 2 part-time family advisor positions, which I'm really excited that one of our Family Voice Council members became a state employee and is in that family advisor role. Next slide, please. Jessica in Oregon spoke to this a little bit about how her own experience and involvement with families changed her thinking. And this feedback loop, what changes are being made based on family input and feedback. And we track that. We have a full dashboard. And here's just a snippet of some of the things that we track. Overall impressions. So for our presenters, did it change your thinking considerably? And you can see that blue bar, yes. Before and after the presentation, it has really shaped the presenter's thinking on XYZ topic. A number of actions taken. So when we do prep calls with presenters, we tell them, we're going to send you a survey and you better come up with at least one action you're going to take based on the presentation and the things that you hear from families. And so we track that as well. And then we ask them, when do you want us to follow up with you? 30, 60, 90 days, you tell us. automated email goes out and says, okay, how are you doing on those actions you said you were going to take? Have they been implemented? Are they still in consideration? Do you need more support? And that is all tracked on our dashboard. Happy to say we have provided input in over 75 statewide programs to date. Next slide, please. And then lastly, what I saw in a lot of questions and in the Q&A recently is around compensation. So just a couple of things I want to highlight. The difference between compensation and reimbursement being mileage or childcare, adult care, compensation actually counting as earned income. Rate setting, people said $40 an hour. We are also at $40 an hour based on a living wage of a single parent with 2 kids living in Denver, and what independent sector says is a volunteer hour. Payment options, we give the families options on how they would like to receive payment, gift card, check, direct deposit. They are set up as independent contractors in our state systems. So we do ask them to fill out W-9s. If they make over the $600 a year, they do get 1099s at the end of the day. Michigan mentioned this, avoiding benefits cliffs, having a policy that actually disregards income for eligibility on all the programs. We have also done that. And then having a conversation with them up front so that they know all the ins and outs around compensation is vastly important. If you want to download any tool or template that we use here in Colorado, we have a Family Voice Compass, which is an online tool where you can download any information and you can rebrand it and use it for yourself. So I'm going to kick it over to Robert to share the Leavers survey data and changes made based on Family Voice Council feedback.
Thank you, Chelsea. I'll try to keep it brief for the sake of time, but hello, everyone. I'm Robert Thompson. I'm a research analyst with the Colorado Department of Human Services, Division of Economic and Workforce Support. I am thrilled to be speaking on this topic. It is one that's close to heart. And I just want to thank all the council members that spoke today and that are attending today. Samantha, you really nailed it with what I'm talking about today. So I'm just going to expand a little bit because she really covered it. So just related to our revision cycle with the TANF Leavers survey, she spoke to concrete actions impacting her community. That's certainly true. The response rate for the survey jumped from 18 to 20% and remains stable. We're still, hoping for more as we go. But Samantha was certainly our star, going above and beyond and really helping to get the survey to where it is, noting that we will constantly continue to try to improve it. And as Chelsea and Samantha mentioned, partnering with our division is one of the many initiatives that the Family Voice Council is involved in. So we've also gone back to discuss the survey briefs. So we do data briefs as well. Next slide. Just a brief overview of how TANF looks in Colorado. It's similar to other states. Colorado Works is Colorado's Temporary Assistance for Needy Family Program, or TANF. Through this program, clients receive cash assistance and most families receive work support through the Workforce Development Program. Colorado Works operates in all 64 counties and is delivered locally through each county's Department of Human or Social Services. Next slide. The Colorado Works Leavers survey helps CDHS assess the effectiveness of the Colorado Works program and make improvements. The survey is sent to a sample of Colorado Works participants who have recently left the program. The survey includes questions about Colorado Works participants' experience in the program, beliefs about the goals of the program, perceptions on how the program contributed to family goals, reasons for leaving, current employment status. It just provides insights into the lives of the people that are recipients of the benefits offered from Colorado. So it helps us gain a deeper understanding of clients' needs, childcare needs, family needs, housing, transportation, basic cash assistance, and highlighting supportive services that I talked about earlier. Next slide, please. So for 2 consecutive years, the Family Voice Council was invited to help us make this survey better. The Family Voice Council members were asked to review questions and take the survey. We covered questions including, how would you feel if you were taking the survey? Would you feel comfortable being honest? How do we increase trust? Were the questions easy to understand? Does it feel too formal? And we got resounding feedback on both iterations for both sections, and it was wonderful. And as Chelsea talked about, we also had a SMART goal at the end that we followed up with, and so we followed up and came back to discuss, the impact of their revision. So we'll go to the next slide. So the revision cycle involved a work group of CDHS staff, our vendor public consulting group, shout out to them, Family Voice Council, Colorado Works clients also were cognitively interviewed. We looked at survey length. The average time to take the survey, even with new questions, is now 15 minutes. So that was the first box, first row. The second row, there should be a space to share openly. This actually led to a qualitative investigation that we've done with an infographic, and it's helping us understand in much more detail with open-ended responses, just what the client experience is and how it could be improved. The third row, we've been specifically focusing on child-only clients for a number of reasons, thanks to this feedback especially. Just due to minimal case management, no work requirement, child-only families' reason for leaving is often that the child ages out. So that kind of really pointed our attention there. And finally, confusing human services terminology, we removed that. So these were just tangible outputs that happened as a result. Honestly, the FVC feedback was my favorite, and it was the best feedback we received. So we hope to continue to partner. One more slide. Kind of confusing looking, but just another way our survey revisions impacted the survey. So we did 2 cycles in March of 22 and March of 23. So in 2021, 66 question items out of 108 had a missingness percentage of 2.5% or lower. So already a strong percentage after 5 years of administering, but 39% had a higher missingness or skip rate at that point than 2.5%. After implementing our revisions into the survey, the questions increased to 155, but we still remained, it went to 64% of the questions had less than 2.5% skip rate or missingness. And the missingness of questions had a higher skip rate than 2.5%. That dropped that year to 34%. So a 5% change in just 1 year. I'm going to pass it back to Chelsea, and then we'll have a few minutes for questions, hopefully. Thank you.
I have nothing left to say. Great job, team.
Thank you so much, everyone. We are going now to transition now to Q&A. Now, we had a lot of great content today, so unfortunately we have not a whole lot of time for Q&A. But a topic has come up in the Q&A a couple of times that I want to put to our parent experts on the panel. So if I could please ask Shaunta, Diane, and Samantha to turn your videos on, I'll direct this one to you. A question has come up in the course of the chat, and then also in the questions we got earlier, about strategies for building trust on a parent advisory council. And I wondered if any of you would be comfortable speaking to either strategies you observe or advice you might give to folks who are thinking about having a parent advisory council to build trust with parent experts. Samantha.
Sure. Yeah. When I first joined a council, one of the things I realized was they leveled the playing field for me. I didn't really know who was in the group. I didn't realize I was actually sitting next to the director of Medicaid. Family Voice Council, it was the same. It was like we were the ones that were in there. We didn't feel like there were people in there like watching over us or like looking to see what we were going to say. So leveling the playing field was really important to me because then I could speak because I felt like I was on the same level with everyone, and that was important to me.
Thank you, Samantha. Shaunta, I see you have your hand up.
Yes, the greatest way to build trust is impact on their voice, right? If I express my voice and it's a policy or procedure change and it affects people in the state of Michigan, now I know I can trust that you're listening and that it's having impact. That's the greatest way to build trust.
Thank you, sir. And Diane, may I turn it over to you?
Absolutely. So I think being somebody that, you know, isn't with the agency or employed in one way or another, building trust for us as members was a little bit difficult. I think really the roles were kind of like us building trust with child welfare. You know, a lot of us had, you know, traumatic experiences with them, and how could you possibly have a relationship with somebody, you know, who took you through this traumatic experience in your life, and and, you know, the age or the gap in, you know, how long our cases had been closed. Some of them had been 2 years. Some of it, like mine, has been 14 years. And so it was really honestly just one day at a time, because every single time we met, probably within the first year, something new had come up, whether that was facing, you know, the very worker that took your kids. So building a relationship with child welfare and its staff and its community partners was very difficult for me, only because these people, you know, were again involved in a very traumatic part of my life. And so how I noticed that I could trust them at a certain point was actually being heard. There's a difference between somebody hearing you and actually hearing and listening to you. And that was accomplished, you know, with, you know, the feedback we were given, like, we heard you say this, this is what you would like to see. And then seeing that implemented in the change that we are making with child welfare. And so it really wasn't easy, to be honest. But I think now that, you know, it's been a year and a half and we've all just built relationships. Jessica was actually my very first caseworker when my cases were open with child welfare. So I've known her for 15 years, and it's been a long time coming, but it wasn't easy to set aside those differences, or in some cases, you know, that traumatic experience, to be able to work with the very people, you know, that was a part of that. So as a parent, it's you just know, you know who's at your table, you know who is there for you, you know who's willing to work from you. You can weed through the people that are just there to do their job. It's not like that in our circle or with the council. Everybody that is there wants to be there, that wants to work with us, that doesn't look at us any different than their partner. We're not just parents with lived experience, like, we are partners, we're in this together, and everybody at our table knows that. So yeah.
Well, couldn't think of a better way to close, Diane, than with that comment. Thank you so much, Diane, Samantha, Shaunta, all of our wonderful presenters today. We're sorry we didn't have enough time to get to all the questions in the chat. Hopefully we covered a lot of the questions that folks had, but you'll be getting an email soon that has the recording for this webinar, some additional resources, and a survey to ask for your opinion about how things went today. So please keep an eye out for that. I want to extend my greatest thanks so much again to all of our wonderful presenters today. Thank you for taking your time. Thank you for sharing your expertise. We appreciate you, and hope everyone has a great day. Thank you.